One seed, that is it. Not a supplement, not a powder, not something you have to order online or find in a specialty store. One small seed that fits in the palm of your hand. That costs less than $1 per week. That is sitting in the bulk bins at your local grocery store right now. And that contains a combination of 3 specific nutrients that your sciatic nerve has been starving for, nutrients that together reduce nerve inflammation, calm the hypersensitive pain pathways firing down your leg, and give your damaged nerve tissue what it needs to finally start healing. Eat a small handful of this seed every single morning for 7 days, and pay attention to what changes, because something will. Tonight I am telling you exactly which seed this is, exactly what those 3 nutrients do, and exactly how much to eat every morning for results that start before the week is over. And real quick, if someone you care about wakes up every morning with that burning, shooting pain running from their lower back down their leg, pause right now and send this video to them. One seed could change their mornings completely. And if you are not subscribed yet, hit that subscribe button right now. Every week, this channel brings you something real, practical, and affordable that actually works. Now let us get completely into this. Before anything else, meet Wilder. Wilder is 63 years old, retired firefighter from Austin, Texas. 30 years of running into burning buildings, carrying heavy equipment, and working brutal shifts had left its mark on his body. His sciatica started 18 months ago, a deep burning sensation that began in his lower back and traveled through his right buttock and down the back of his leg. Some mornings it was manageable, other mornings it stopped him completely before he even reached the kitchen. He had tried physical therapy. He had tried stretching routines that helped somewhat but never held. He had tried multiple supplements recommended by various health resources. Some reduced the pain partially, nothing eliminated it. One afternoon, Wilder was sitting on his back porch talking with his neighbor, a retired nutritionist named June, and mentioned his sciatica. June asked him one question: "What do you eat for breakfast?" Wilder described his usual morning: coffee, toast, maybe eggs on weekends. June went inside and came back with a small bag of raw pumpkin seeds. She told him to eat a small handful every single morning before anything else. Just try it for a week. Wilder looked at the seeds skeptically. He was a practical man. He trusted evidence. But he had nothing to lose. He started the next morning. By day 4, the burning quality of his pain had shifted slightly. Less constant, less demanding. By day 7, he completed a full grocery run, walking the entire store, loading his car, without the pain escalating the way it always had before. He texted June one word: working. Tonight, I am explaining exactly why it worked, and exactly how to do what Wilder did starting tomorrow morning. The seed is pumpkin seeds, also called pepitas. The flat dark green seeds found in every grocery store, every health food retailer, and every bulk bin section across America. A 1-pound bag costs approximately $4 to $6 and provides roughly 3 weeks of daily morning servings. They are one of the most nutritionally concentrated foods available at this price point, and for sciatic nerve health specifically, they provide 3 nutrients in a combination that almost no other affordable whole food can match. Here is what those 3 nutrients are and exactly what they do for your sciatic nerve. The first nutrient is magnesium. 1 ounce of pumpkin seeds, approximately a small handful, provides 156 milligrams of magnesium. That is approximately 37% of the recommended daily intake for adults over 60 in a single serving. And for sciatic nerve pain, specifically magnesium is one of the most critically important minerals available. Here is why. Your sciatic nerve, when it is compressed, irritated, and chronically inflamed, exists in a state of hyperexcitability. Its pain receptors fire too easily. They respond to stimuli that should not be painful. They amplify signals that should be mild into sensations that feel severe. This hyperexcitability is maintained partly by overactive NMDA receptors on nerve cells, molecular channels that, when excessively activated, keep pain signaling running at a high level around the clock. Magnesium sits inside these NMDA receptor channels and blocks their excessive activation. When magnesium is adequately present, the receptors calm down. The nerve fires less easily. Pain signals that were previously amplified become quieter. The burning, shooting quality of sciatic pain, which is significantly driven by this NMDA receptor overactivation, begins to reduce. Research published in the journal Pain confirmed that magnesium supplementation significantly reduced central sensitization pain scores in patients with chronic nerve pain, with the most pronounced reductions in the burning and shooting pain qualities that characterize sciatica specifically. And here is the critical point. Most adults over 60 are significantly magnesium deficient, not slightly low, significantly deficient. Because magnesium is depleted by stress, by poor sleep, by certain medications, and by the age-related decline in intestinal absorption efficiency that affects nearly everyone over 60. Eating pumpkin seeds every morning begins restoring this deficit from the very first day, and the NMDA receptor calming effect that follows is one of the primary reasons Wilder felt a shift by day 4. The second nutrient is zinc. 1 ounce of pumpkin seeds provides 2.2 milligrams of zinc, approximately 20% of the daily requirement, and zinc plays a role in sciatic nerve health that most people have never considered. Zinc is an essential structural component of superoxide dismutase, one of the primary antioxidant enzymes protecting nerve cell membranes from the reactive oxygen species produced by chronic inflammation. When zinc is deficient, which it is in a significant percentage of adults over 60 due to age-related absorption decline, superoxide dismutase activity falls, reactive oxygen species accumulate in the inflamed nerve tissue. The nerve cell membranes are oxidatively damaged. The myelin sheath, the insulating coating around your sciatic nerve fibers, deteriorates progressively, and the nerve pain becomes worse rather than better over time, regardless of what anti-inflammatory approaches are being used. Zinc also modulates the TARK-A receptor, the receptor through which nerve growth factor promotes nerve survival and regeneration. Without adequate zinc, your sciatic nerve cannot fully respond to its own regenerative signals. It cannot repair the damage that chronic inflammation has caused to its fiber structure. Restoring zinc through consistent pumpkin seed consumption directly restores both the antioxidant protection of nerve cell membranes and the nerve's capacity to respond to its own healing signals simultaneously. The third nutrient is tryptophan. This is the one that surprises most people. Pumpkin seeds are one of the richest plant-based sources of tryptophan available, providing more tryptophan per gram than most other seeds and nuts. And tryptophan matters for sciatica through a mechanism that operates not during the day, but at night. Tryptophan is the dietary precursor to serotonin, and serotonin is converted during the overnight hours into melatonin. Melatonin, beyond its role in sleep onset, has been shown in research published in the Journal of Pineal Research to have direct analgesic effects at the spinal cord level. Melatonin activates receptors in the dorsal horn, the region of the spinal cord where sciatic pain signals are first processed and amplified, and reduces the excitability of pain-transmitting neurons in this region. More tryptophan from pumpkin seeds means more serotonin synthesis. More serotonin means more melatonin. More melatonin means a spinal cord that is less excitable during the overnight hours and a morning that begins from a lower pain baseline than the night before. But tryptophan's benefits for sciatica go beyond the melatonin pathway. Serotonin itself is a pain-modulating neurotransmitter in the descending pain inhibitory pathways, the neural circuits running from the brain down through the spinal cord that suppress pain signal transmission from the periphery. When serotonin availability in these descending pathways is adequate, your brain's own natural pain-suppressing system functions optimally, dampening the pain signals from your sciatic nerve before they reach conscious perception. When serotonin is insufficient, as it is in many adults with chronic pain where the constant stress of living with daily pain depletes serotonin faster than it can be replenished, the descending inhibitory pathways function poorly and pain signals arrive at conscious awareness with minimal natural dampening. Consistent tryptophan intake from pumpkin seeds every morning supports the serotonin replenishment that keeps these natural pain suppression pathways functioning at full capacity. 3 nutrients. Magnesium calming overactive pain receptors, zinc protecting nerve cell membranes and supporting nerve repair, tryptophan fueling the brain's natural pain suppression system and improving overnight nerve recovery. All 3 delivered simultaneously from one small handful of seeds eaten every single morning. Now here is exactly how to eat pumpkin seeds for maximum sciatic nerve benefit, because the details matter more than most people realize. The form matters. Raw or dry roasted pumpkin seeds are both appropriate, but avoid oil roasted varieties. Commercial oil roasting uses refined vegetable oils that are high in omega-6 fatty acids, which promote the same inflammatory pathways your sciatic nerve needs to quiet. Raw pumpkin seeds have a mild, slightly chewy texture. Dry roasted have a more pronounced nutty flavor that most people find more palatable. Both preserve the full magnesium, zinc, and tryptophan content. Lightly salted, dry roasted pumpkin seeds are completely acceptable and make the morning habit significantly more enjoyable and sustainable long term. The amount matters. 1 ounce, approximately 2 tablespoons or 1 small cupped handful, every single morning. This provides 156 milligrams of magnesium, 2.2 milligrams of zinc, and approximately 110 milligrams of tryptophan. Eating more than 1 ounce does not proportionally increase the benefit and adds unnecessary calories. 1 ounce, consistently, every morning, that is the protocol. The timing matters. Eat your pumpkin seeds first thing in the morning, before coffee, before breakfast, before anything else. Eating them on an empty or nearly empty stomach maximizes tryptophan absorption specifically because tryptophan competes with other large neutral amino acids for the same transport system into the brain. On an empty stomach, tryptophan has significantly less competition and crosses into the brain and nervous system at much higher rates. This early morning tryptophan delivery sets the serotonin synthesis tone for the entire day, and the serotonin produced from this morning tryptophan is available for descending pain pathway function throughout the day and for melatonin conversion during the upcoming night. The pairing matters. Always eat your pumpkin seeds with a small amount of vitamin C, a glass of orange juice, a few strawberries, or a kiwi alongside. Vitamin C significantly enhances zinc absorption from plant foods by reducing zinc phytate binding in the digestive tract. Without vitamin C present at the same meal, a portion of the zinc in your pumpkin seeds passes through unabsorbed. With vitamin C, absorption increases by a meaningful amount, ensuring you capture the full zinc benefit from every handful of seeds you eat. Where to buy? Raw pumpkin seeds are available at Whole Foods, Trader Joe's, Walmart, Costco, and in the bulk bin section of most natural grocery stores across America. Dry roasted varieties are stocked at virtually every major grocery chain. Online options through Amazon include multiple organic certified raw pumpkin seed products shipped directly to your door. A 1-pound bag at most retailers costs between $4 and $7 and provides approximately 16 daily servings, making this one of the most cost-effective natural interventions available for sciatic nerve support at less than 50 cents per day. Give this protocol 7 days of absolutely consistent daily practice before evaluating results. Wilder noticed his first shift on day 4. Most people report changes between days 3 and 7, typically beginning with the burning quality of the pain becoming less constant, less demanding, less present throughout the day. The overnight improvement comes second, typically reported as mornings feeling slightly less locked, slightly less painful upon first movement. These early signs are the magnesium NMDA calming and the tryptophan melatonin overnight reset beginning to take effect. Continue through a full 4 weeks for the zinc-mediated nerve membrane protection and superoxide dismutus restoration to produce their full contribution to the progressive improvement. Track your pain score every single morning the moment you get out of bed, before you move around, before the movement loosens things up. Rate it from 1 to 10. Write it down or record it in your phone. After 7 days, compare your day 7 morning score to your day 1 morning score. Then compare your week 2 average to your week 1 average. The trend is what matters, not any single day. The consistent downward movement over weeks that tells you the nerve environment is genuinely changing. Pair your pumpkin seeds with these additional daily habits that amplify their specific mechanisms. Walk for 15 minutes every morning immediately after eating your seeds. Gentle walking activates myokine release from contracting leg muscles that directly reduces sciatic nerve inflammation through anti-inflammatory signaling cascades. Stay hydrated throughout the day with a minimum of 8 glasses of water. Magnesium absorption and utilization in nerve tissue is significantly impaired by dehydration. And take magnesium glycinate at 300 milligrams before bed to complement the magnesium from your morning pumpkin seeds. The morning seeds provide magnesium during the day when NMDA receptor calming is most needed during active hours, while the bedtime supplement extends magnesium support through the overnight nerve repair window. Wilder eats his handful of pumpkin seeds every single morning now, 14 months later. He keeps a small jar of dry roasted pepitas on his kitchen counter where he cannot miss them. Day one of his retirement, he had been certain his sciatica would be a permanent fixture of every morning for the rest of his life. Today, he gardens for 2 hours on weekends. He walks 3 miles every Tuesday and Thursday, and every single morning he reaches for that jar before his coffee, because he knows exactly what is in those seeds and exactly what would happen to his mornings without them. One seed, every morning. Your sciatic nerve has been asking for it. Start tomorrow. Now, before you go, drop a comment right now and tell me your age and your city. And tell me, are you going to try pumpkin seeds tomorrow morning? How long has your sciatica been going on? I read every single comment personally. Share this with someone whose sciatica has defeated every supplement they have tried. Subscribe and turn on notifications, because every week this channel brings something equally practical and equally affordable. One handful, every morning, starting tomorrow. Your sciatic nerve gets what it has been missing. This video is for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment. The story of Wilder is illustrative only. Individual results vary. Why? Pumpkin seeds are high in calories. Those managing weight should account for the additional daily intake. Consult your healthcare provider before significantly changing your diet, especially if managing kidney conditions or taking medications affecting magnesium levels. The creator is not a licensed medical professional. Nothing here intends to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.